to introduce our esteemed speaker for the evening, Dr. Manoj Kumar, an eminent public health academician and the chairperson, Center for Public Health, Panjab University, Chandigarh. Dr. Kumar has more than 17 years of experience of postgraduate teaching and research. He has supervised over 140 MPH dissertations and 4 PhD scholars, including mentoring a Fulbright Nehru Fellow. He has an excellent academic footprint with 85 publications, 11 books and book chapters, and over 6,400 citations, and an H index of 18. He is also an innovator with 3 patents and 1 copyright. AI Alzheimer's alert device, ML-based fraud detection in healthcare finance, AI proctoring device. He has received several awards, including Dr. G.C. Boral Award, Dr. S.D. Gaur Award, awards from AIMS Rishikesh, Eternal University, PGIMR Fellowship. Today, Sir will be presenting from data to discovery, conducting robust observational studies with STROBE. I welcome you, sir.
Thank you, Dr. Isha. Am I audible?
Yes, sir.
Yes, sir. Yes, sir.
Yeah. Thank you, Principal Sir and all organizing committee. And this is a very. Thank you, Dr. Isha. Am I audible?
Yes, sir.
Yes, sir. Yes, sir.
Yeah. Thank you, Principal Sir and all organizing committee. And this is a very starting topic for conducting research. So I will share my slides. I think slides are visible now.
Yes, sir.
Yes, sir.
Okay. So, good evening, everyone. And as the topic of discussion is from data to discovery and conducting a robust observational study with STROBE guidelines. So this is about the total slides contents. Like I will introduce about the different type of studies, cohort study, case control, cross-section study, and how we use to control the quality of our research by using STROBE checklist. So we are aware about the different types of study design. There are different types of classifications given in your textbooks in medical or in epidemiology books. So study design broadly can be like descriptive and analytical. So descriptive further can be case report, case series, descriptive incidence studies, descriptive prevalence studies, ecological or correlation studies, and similarly analytical studies can also be divided in observational and experimental. So observational are of case control, cohort, and comparative cross-sectional studies. So today we are discussing about observational studies. And another part is experimental studies. We are not discussing this part, although it is maybe two type, randomized control trial and classical experimental design. So like in observational study, we can have 3 major categories: cross-sectional, case control, and cohort. So like in cross-sectional, disease and exposure both are present. In cohort, like exposure present, but disease will be developed. And in case control, like disease is present and depend upon the future exposure. So this is again a classification, like we can also divide it non-experimental and experimental or international studies. So observational studies is further like population-based population-based studies are health surveys, ecological surveys. Individual-based include case report, case series, and analytical include cross-sectional case control cohort. So today we are discussing these three studies with reference to STROBE guidelines, and another part include experimental and interventional, randomized and non-randomized control trials. This is again classification, like you can say epidemiological studies, descriptive analytical, descriptive further case report, case series, descriptive surveys, analytical, observational, experimental. So observational studies include analytical and descriptive. Analytical include cohort, case control, and cross-sectional, and descriptive include case report and case series. And study design is like experimental and observational. So these are classification slides which are repeating. So this is again about the different qualities that we have. So observational research means we have to observe the risk factor and disease. So complete. This is a sample text that you can edit, you can change. So इसमें ऑब्जर्वेशनल स्टडीज के अंदर बेसिकली जो है कई बार हम लोग क्वेश्चनर प्रोवाइड करके इंफॉर्मेशन कलेक्ट करते हैं, कई बार हम जस्ट ऑब्जर्व करते हैं. सो एक्सपेरिमेंटल वर्सेस ऑब्जर्वेशनल स्टडीज, यू कैन से experimental studies, we give some intervention or treatment, but in this we simply observe response, no attempt or influence. And in experimental can determine causation and cannot determine causation, only correlation we observe. So observational studies versus experimental. Observational observe individuals and measures variable of interest but does not attempt to influence the response. An experiment deliberately imposes some treatment on individual to measure their response. When our goal is to understand cause and effect, experiments are the only source of fully convincing data. The distinction between observational study and experimental is one of the most important in statistics. So this is the like silent features. Observational studies, no treatment is assigned, self-selection, merely observing characteristic, prospective versus retrospective. Prospectives pick subject, then follow them for some times. Retrospective pick subject, then look their past records. And experimental is having some treatment. So this is about a randomized assignment. In experiment, observational studies, random selection. And in experiment can determine causation, cannot determine causation. Here only we see the correlation. May not be ethical. This will be ethical. So what is observation? A type of data collection that involves the watching, inspecting, and taking notes of behaviors and the environment. So observational study include like individual and records variable of interest, but does not attempt to influence the responses, does not impose a treatment, allow the researcher to directly observe the behavior of interest rather than rely on subjects' self-descriptions or survey, allow the researcher to study the subject in its natural environment, thus removing the potential biased effect of the unnatural laboratory setting on the subject's performance. So these are like further, we can say silent features. Cross-sectional studies. Before go to the STROBE guideline, we must know what are the different silent features of these three important observational studies: cross-sectional, case control, and longitudinal. So cross-sectional is basically a single time point defines a population of individuals at a specific point in time. Observation made on individual to describe presence of disease or other characteristics. So in this, basically we calculate prevalence and incidence. So means standard deviations or regression, odds ratio, relativity, etc. Common data summaries further, and problem encountered unsuitable for rare disease or disease of short duration. Case control, typically retrospective, causes, non-cases, etc. In this we calculate relative risk and odds ratio. Longitudinal studies, or you can say cohort studies, maybe prospective and retrospective. In this we calculate uh, attributable risk and relative risk. Sometimes we have a specific type of nested case control in like case control having a specific cohort. Then two types of observational studies broadly, like retrospective and prospective. So retrospective, selecting subject and then collecting data from their past, and prospective, selecting subject and then follow them to collect data for few years, like 4 year, 5 year or 10 year or 20 years. Then observational research, what may be the advantage and disadvantage. The observational method is an easy method since it is usually does not require technical skills. In disadvantage in the observational method, not everything is observed. Feeling, emotions of opinion remains unobserved. Advantage, second advantage is the observation method provides high accuracy since the observer directly interacts with the observed. And in disadvantage is observation is costly method since it requires a lot of things. Third one is it is a universal and standard method that is used all over the world. The observation method describes the phenomena exactly as it occurs in its natural research environment. And disadvantage include observation is very time consuming process, and there are chances that the observer and observed will lose interest in it after certain point of time. And fourth one is in the observation method, the very minimum cooperation of the respondent is required. And like disadvantage, there is absolutely no way of knowing the past life. The researcher has to rely on documents that are present. So these are the different types of studies. In this, we can say like most uh, uh, level of evidence is highest in among the meta-analysis or randomized control trial, and like this is decrease yeah, like increasing order, like cohort study, then case control, then case report or case series, and animal and uh, laboratory studies. So this lowest broadest part, animal and laboratory studies have uh, more reliable results, and you can say this uh, establish relationship, like what is the cause. Then observational studies of disease. So descriptive include incidence and prevalence, and analytical include association characteristic of population with risk of disease. Population experience can be studied with group of level of individual level data. Studies using group level data are called ecological studies. So these three will be today we will consider in our STORB guidelines. So observational study, cohort, case control, cross-sectional, prospective, retrospective. So these are the silent features: ecological, proportional, case crossover, cross-sectional, case control, retrospective. In ecological, we calculate prevalence ratio, and proportional mortality, standardized mortality, and proportional mortality. Then case crossover, we measure odds ratio, Cross-sectional, we calculate mostly point prevalence and period prevalence. And case control, we calculate normally relative risk. And in cohort, we calculate attributable risk. So these are the types of observational studies. What is case report? Observation made in a single patient. And what is case series? Observation that ties together a group of patients. Cross-sectional, observation of the prevalence of disease within defined population for a specific period of time. Then case control is we have case and control, the retrospective study in which causality is determined, and cohort, a prospective study in which risk factors are followed to determine causality. So these are the observational studies. Then observational studies, yes, no. Does it have a comparison group? Analytical studies, yes, in cohort and in case control when we calculate relative risk. And in case cross-sectional case report, case series, we are not having any comparison group. Then experimental and observational studies. Experimental studies, we are not discussing today. Only observational study we are discussing. So basically, in experimental studies, we give some treatment to the patient, then or animal, then we observe. In observational study, units are sampled from 2 or more population. Observational factor includes set of levels of population, subpopulation used in the study. Causation is directly obtained in experimental study, not in observational study. So sometimes mixed design also used. So observational study cross-sectional is observation made from population, subpopulation at a single time or point or interval. Like it is like a photograph of the population or community. Prospective, it is like a movie. Group are formed by a level of potential causal factor, then observed over the time of for some measurable outcomes. Retrospective studies where subjects are identified based on outcome of interest, potential risk factors are identified that previously occurred. Matching, sometimes we do the matching for interpretation of better results. We take equal samples from cases and equal from control. Then observational study in which treatment or exposure of interest is not assigned but occurs by choice or happenstance and depend on people's natural or voluntary exposures to factors not ordinarily randomly assigned. Always the possibility that the exposed and unexposed differ in important way other than exposure. So observational studies include like discovering trends and possible relations. So basically in observational study we see the trends of or of risk factor or disease or possible relationship. And however, it is not possible to for observational study whether prospective or retrospective to demonstrate a causal relationship. So retrospective study identify a group of subjects and examine their past to determine the effect of coal mining on lungs health, examining the health histories of a sample of 500 coal miners. Prospective identify a group of subjects and then track then over a period of time identifying a set of miners early in their career and track their health and other factors in the lives over 20 years. But when we follow, sometimes there is a issue like many subjects or sometimes there is committee changed, like many of the subjects may migrate or may come from inside this study groups or cohort. So this is like okay, types of observational study. So case report, clinical observation, case series, clinical observation, ecological association, existing data. Cross-sectional is a like prevalence study, existing new data. Case control, new data, cohort, prospective, existing, new data and prospective new data. So observational study, no treatment, and just we observe and see the association. And why observational study we are considering, or why it is first priority? Like it is a cheaper to conduct. It is a faster. Whenever any epidemic occurs, we go for cross-section study. Can examine long-term effects. Hypothesis generating. Sometimes experimental studies are not ethical, randomized subject to smoke. So observational study design, like three we are taking. So cohort is typically examining multiple health effects of an exposure. Subjects are defined according to their exposure level and followed for disease occurrence, like industrial worker or like smokers, or to identify the lung cancer. Case control studies typically examine multiple exposure in relation to a disease. Subjects are defined as case and control, and exposure histories are compared, like cases of TB patient and non-TB patient. Cross-sectional studies examines relationship between exposure and disease and calculate prevalence in a defined population at a single point of time. Observation research methods. So type of observation: overt, covert. Overt means participants know they are being observed sometimes. So it may cause bias. Advantage: non-ethical issues. Disadvantage: behavior may not be natural or normal. If participant think that he is being observed. And covert: participant unaware they are being observed. So high ecological validity and ethical issues. Participants, the observer, become actively involved in the activities of the people being studied. Easier to understand the observer's behavior. High ecological validity. Disadvantage: hard to record observation retrospective. Therefore, low reliability. Observer can become involved with the participants and the data subjects. Non-participants, researcher observing from a distance. Observation made as then they happen more reliable. Lack of contact, so observer can maintain objectivity. Behavior may be recorded by the meaning behind it unknown. So what are the three types of observation study? Like these are. So we start with the cross-sectional study population. Study population with increasing time, so may disease present or not present, and their risk factor present or uh, factor absent, factor present, factor absent in disease and non-disease both. Case control, uh, X case control, like you can say this is the onset of the study. So it may be cases, and control maybe we can in first case is like cases with exposed and unexposed, and second one is current control, exposed and unexposed. So we may go retrospective and we may go prospective both. And this is cohort study type. Cohort studies are important in research designing. The term cohort is a group of people or having some common factors. So it is a type of non-experimental or observational studies, and it is called as a group of soldiers. The term cohort refers to a group of people who have been included in a study by an event that is based on the definition decided by the researcher. So type of cohort studies: prospective and retrospective. None of the subjects have the disease being measured when the study commences. Data analysis happen after a period of time has elapsed, and retrospective is historical. The researcher looks at the historical data for a group. Some of the people in this group have developed the disease and some have not. This can result in finding out who has the disease and when they develop it. So this is the diagram showing cohort studies like exposed and unexposed cohort. So if it is exposed, so disease may develop and may not disease free over a period of time in future. Unexposed include like further disease develop or disease free. So data collection, survey method, observation and case studies, and this is about the like cohort population. We start with the population study sample, screen for healthy peoples, then exposure and yes or no outcomes, new cases and new cases. This is prospective cohort, like from population cohort 1 and cohort 2, then cohort 1 having exposure and cohort 2 having non-exposure. So further whether disease develop or not develop. Similarly, in prospective cohort, start with the research. Researcher recruits healthy samples cohort and data collection on risk factors and outcomes, smoker, non-smokers. And further, if you see like in non-smoker and non-smoker, whether disease or non-disease. So retrospective cohort, development of outcomes, like we go for their history part and we collect data, past data from their records or by asking questions. So development of outcomes, whether they have disease or not disease, and further whether find from the whether they were a smoker or non-smoker. So summary points we can say like several design cohort, historical cohort, case control, etc. are available to estimate the association between an exposure and disease incidence. The optimal design choice depends on the precise research questions such as whether absolute or relative risks are needed. The choice also depends on strength and weakness of the various design, given practical constraints. Good design can limit threats to internal validity such as measurement error, selection bias, impressive estimates and confounding, and promote generalizability, and serious mistake in design cannot be corrected by statistical analysis. So the topic actually is these are the different kinds of study. Now we are thinking how can we improve the quality of these studies. So there are two different kinds of uh, guidelines. One is IMRAD and another is STROBE statements or guidelines. So these two guidelines we follow for the quality check for the conducting this study. What is IMRAD? IMRAD is introduction, method, result, and discussion. So we have to check in our article or in our research whether we have all these 3-4 like titles in our study or not. So introduction is what question or problem was studied. Methods, how was the problem studied. Our results, what are the findings. A discussion is what do these findings means. So this is a IMRAD format and this is STROBE format. So STROBE is basically strengthening the reporting of observational studies in epidemiology. Is a guideline for reporting observational study like cohort, case control and cross-sectional studies, and the observational studies previous to development of STROBE did not explain the confounding variable nor had any reporting on the methods of selecting the study and control groups. So these are available on the net and you can you can find it from this website www.strobestatement.org. So STROBE statements is guidance on how to report observational studies well focus on three main studies designed on cohort, case control, cross-sectional. And it was published, these guidelines were published in the year 2007 like short paper and E&E, and adopted by many journals. So like these are the two sites where you can find in detail guidelines. There are 22 criterias. So quality of observation studies, STROBE. STROBE stand for an international collaboration initiative of epidemiologists, methodologists, statisticians, researchers, and journal editors involved in the conduct and dissemination of observational study with the common aim of strengthening the reporting of observational studies in epidemiology. So STROBE statements, guidance on how to report observational study. These are the you can say link where you can find the details of this. So scope include epidemiological research comprise several study design and multiple topics, and it includes initially restriction to three major areas: cohort, case control, cross sectional. So later extension to other study design is STREGA, STREGA for genetic association studies, STROBE ME for molecular studies, molecular epidemiology studies. So these are the guidelines further categorized. So STREGA is reporting of genetic association studies, strengthening the reporting of genetic association studies, guideline developed to improve reporting quality of genetic association studies. So if we are doing particular genetic study, then we have to follow this these guidelines. It helps researcher ensure that they include all relevant information in their publication, adding in transparency, reproducibility, and interpretations. So STROBE guidance on how to report observation study will was explained in for these three. So there are common factors for all these three. So STROBE actually comes in the year 2007, and after that in the year 2009 STREGA comes. So STREGA for genetic association studies actually. Then STROBE ME is for molecular epidemiology. It comes in the year 2011. Then this is the guideline you must know while preparing your articles, or while you are before sending your any research into the journals. So you must be aware what are the STROBE abstract guidelines. So you must have title. So indicate the study design with a commonly used term in the title: cohort, case control, or cohort. So it must be mentioned in your title actually. Authors, contact detail for corresponding authors, study design, description of the study design clearly must be mentioned. Objective, specific objective or hypothesis must be mentioned. Setting, description of setting, follow-up, dates, etc. Participants, cohort study give the most important eligibility criteria, the most important source and methods of selection of participant. Describe briefly the methods of follow-up. Case control give the major eligibility criteria and the major sources and the method of case ascertainments and control selection. Cross-sectional study give an eligibility criteria and the major sources and methods of selection of participants. So like these are the cohort study for match studies give matching and number of exposed and unexposed. Similarly, case control study for matched studies give matching criteria and the number of control per case. So variable clearly define primary outcomes of this report. Statistical methods. Describe statistical method, include those used to control for confounding. I think all of you know what is confounding. Confounding means mixing together. So so these are the you can say guidelines which you have to follow before submission of your article or epidemiological studies in a journal. So results must include participants, report number of participants at the beginning and the end of the study, like what is the respondent rate, which is very important. Then main results, report estimates of association. If relevant, consider translating estimation of relative risk into absolute risk or meaningful time period. Report appropriate measures of variability and uncertainty, odds ratio with uh, confidence interval, and conclusion general interpretation of study results. So these are the guidelines only for abstract. Then further, you can read all these guidelines or recommendation, like title indicates the study design and provide the abstract to inform informative and balanced summary of what was done. And similarly, introduction objectives must be mentioned properly. Study design, like present key elements of the study, setting, participants, variables. This is the same. So you have to read. Then final STROBE checklist. These are the things you have to check before submission of your article. Title and abstract, introduction, methods, study design, setting, participants, variable, data source, study size, sample size, quantitative variable, statistical method, result, participants, descriptive data, outcome, main results, other variables, key results, limitations of the study, interpretation, generalizability, and funding. This is again STROBE statements. So this is the checklist you have to check, like limitations, interpretation, generalizability, ethics, etc. So STROBE statements strengthening the reporting of observational study in epidemiology. Scope intended to cover three main study design: cohort, case control, cross-sectional. So there are 22 items checklist, which I will show you. I have one PDF file. So 18s are common across all three or four study design, like case control, cross-sectional, and cohort. So these are the checklist with 22 items. Heading, item number, recommendation, divided into cohort, case control, cross-section. We have different. So these are the contents. So in conclusion, the STROBE checklist is typically used to ensure transparent and comprehensive report in observational studies. Including it in conclusion of research paper could involve summarizing how the study adhere to each item on the checklist, highlighting strengthening, limitations, and implication for future research. So this is like brief outlines, and I want to share one PDF document also with you. Is it visible now?
Yes, sir. Visible.
Okay. So this is more clear picture. I will share all this with you. So this is a detailed document which you must know how to use this. So there are 22 items mentioned here till the funding. Okay. So before submitting your article, carefully check all these things, like title and abstract. As I already discussed, study design and commonly used term in the title or abstract. Then provide is the abstract an informative and balanced summary of what was done and what was found. So abstract it must be like around 250 words normally mentioned in each journals. And then introduction part, background, explain. Second, so you have to check 1, 2, 3 whether you have completed all these 22 in your article or not. Then introduction, background, explain the scientific background and rationale for the investigation being reported. Then objective, check have you mentioned a specific objective or not, including pre-specified hypothesis. Then methods, Present key elements of study design early in the paper. Setting, describe the setting, location, and relevant dates, including period of recruitment, exposure, follow-up, and data collection. All these things should be mentioned in your epidemiological research or study. Participants, 6 number. Cohort study or case control or cross-sectional or match studies. So, like if cohort study gives the eligibility criteria, sources and data, describe methods of follow-up, how you follow up and what are the issues, challenges in your cohort study. Then case control, define the case, define the control area, etc. Methods of case ascertainment and control selection. Give the rationale for the choices of cases and control. Similarly, cross-sectional study, give the eligibility criteria and the sources and methods of selection of the participants. And this is for match studies. If we are taking equal numbers of subjects, like give matching criteria and number of exposed and unexposed. Similarly, 7 number is variable, clearly define all outcomes, exposure, predictors, potential confounders, effect modifiers, give diagnosis criteria if applicable. 8th number is data source and measurement. For each variable of interest, give sources of data and details of methods assessment. Describe comparability and of assessment methods if there is more than one group. Biases, what kind of biases may be there? You may write, describe any effort to address potential source of bias. Study size, sample size, you normally we write sample size. Explain how this study size was arrived. Then quantitative variable, explain how quantitative variable were handled in the analysis. If applicable, describe which grouping were chosen and why. Then statistics methods, describe all statistical methods, including those used to control for confounding. Describe any method used to sometimes we do initially we do univariate, then bivariate and logistic regression. So for control of confounding, if you apply logistic regression or any other method you applied, so you have to write in detail. Describe any method used to examine subgroup or interactions and how you calculated your prevalence, incidence, or relative risk or odds ratio or any other like parameter which you mentioned in your results. Explain how missing data were addressed. So there are normally we are not write anything about missing data. So like we ask questions from a subjects, so he answer only out of 100 only 90 questions and 10 questions was unanswered. So similarly in a large group, so how we handle this uh, type of missing data and how we analyze the data. So we have to write all these things in detail in our research paper. Cohort studies, if applicable, explain how loss to follow was addressed, and similarly, if applicable, explain how matching of cases and control was addressed. Cross-sectional studies, if applicable, describe analytical method, taking amount of sampling strategies, describe any sensitive analysis, etc. Then participants, so report number of individual at each stage of study, number potentially eligible, examined for eligibility, confirmed eligible, including in the study, completing follow-up and analysis. Sometimes we use a term like eligible population. So we have to explain all these parameters or all these variable definitions, give response, reasons for non-participation at each stage. So we have to write the reasons also in, if we are doing qualitative analysis, we have to write all these things in detail and how we categorize the variables considered use of a flow diagram if possible, and even map must also be mentioned, study area map. And descriptive, give characteristic of study participant, demographic, clinical, social, and information on exposure and potential confounders. Indicate number of participants with missing data for each variable of interest. Cohort summary, summarize follow-up time, average, and total amount. Because all these, your methodology part is important, and because it all gives like how you interpret your conclusion. So it all depends upon how meticulously you describe your methodology, and it must be in detail actually. Then cohort study report numbers of outcomes, events, or summary measures over time. Case control studies report numbers in each exposure category or summarize measures of exposure. Cross sectional report numbers of outcome, events, or summary measures. Sorry. Then main results, 16 number. Give unadjusted estimates if applicable, confounder adjusted estimates and their precisions, 95% CI, and make clearly the confounders were adjusted for and why they were included. Then report category boundaries when continuous variable were categorized. If relevant, consider translating estimates of relative risk into absolute risk for a meaningful time period. Other analysis report, other analysis done, example, analysis of subgroups, interaction and sensitive analysis. Then 18 number is summarize key results with reference to study objectives. Limitations, you must mention limitation of the study. Even here is, yeah, they have not mentioned, you have to mention strength of the study also. So discuss limitation of the study, taking into the account source of potential biases or impression. Discuss both direction and magnitude of any potential bias. Interpretations, give a cautious overall interpretation of result considering objectives, limitations, multiplicity of analysis, result from similar studies and other relevant evidence. Generalizability, whether your results can be generalized or not, because sometimes you have taken very small sample size. So discuss the generalizability, external validity of the study results. And lastly, you have to mention funding source also. Give the source of funding and the role of the funders for the present study. Sometimes you write like it is a self-funded studies. Sometimes you write if it is sponsored by some research agency like ICMR or DST, etc. If applicable for the original study on which the present article is based. So you have to acknowledge also funding agency, and even your institutes you have to acknowledge while you are submitting your article. Even only acknowledge to the contributor, those who actually participated in your who actually played important role. Like if you have this is your dissertation work, so you must be the first author, and you have to mention your guide name and your those who are directly involved in your research. So these are the guidelines which all of us have to follow while submitting our research article in a journal. So I think this is all about data to discovery and conducting robust observational study with STROBE guidelines. So STROBE guidelines are, these are the STROBE guidelines. So observational studies we normally consider like our case control, cross-sectional case control and cohort study. So this is all about this discussion. So now I think I have completed my time. I'm on the time limit of 1 hour. So if anything, any question, anyone want to ask?
Participants may use their chat box for posting their queries. So we
Even
have two queries with us.
yes, please.
Are there any recommended standards or practical considerations for determining an adequate sample size in observational studies to ensure validity and generalizability? Sorry.
Yes, good question, good question. So, the answer for this question is actually we must know, like, if we are doing a cross-sectional study. So, in cross-sectional study, for a particular population, like if we are doing it in a like city or in a district, so we must know about the total population, first thing. Then about the disease condition for which we are going to study, like if we are doing want to do cross-section study on diabetes, so we have to explore the literature, and we have to go through the literature whether any study on diabetes have been conducted in the same area, or what is the prevalence of that particular disease. So based upon the prevalence and based upon the like total population, we calculate sample size, and sample size is basically uh, like if it we say that population of a district is 1 lakh, and like diabetes prevalence is like 2% or 5%. So if we take we survey for whole population 1 lakh, then there is no we can say bias, or we can say there is no error. We confidently say that there is like 4% or 5% diabetes prevalence in this area. If we like we surveyed a whole the population. But if we calculate sample size of out of 1 lakh, we say our resources and time are limited. So we have calculated our sample size based upon, there are many sample size calculator available on net also, and there is sample size formula also, in which we put the prevalence and total population, and like alpha and beta error. So by considering these error, we calculate the sample size. Larger the sample size, smaller the error. तो जितना ज़्यादा बड़ा हमारा सैंपल साइज होगा, यदि हम कंप्लीट को सैंपल साइज कर लेंगे, तो हमारी जो है उसमें हम उसको जनरलाइज कर सकते हैं और कह सकते हैं एंड श्योरिटी के साथ। और जितना हमारा सैंपल साइज कम होगा, कई बार हमारा टाइम कंस्ट्रेंट होता है, हमें 1 लाख की पॉपुलेशन की जगह हम 100 लोगों का सर्वे करके अपनी स्टडी को पब्लिश करना चाहते हैं। सो इट इज़ नॉट जनरलाइज्ड बिकॉज वी आर हैविंग स्मॉल सैंपल साइज। सो सैंपल साइज जो है अप्रोप्रिएट होना चाहिए। And how this appropriate sample size will be calculated, we have to take the correct prevalence of that disease. So then we can calculate sample size correctly, and we can generalize our results. Is it correct? Okay.
Thank you, sir. We
Yeah.
have a few more queries with us.
Yes.
How can we effectively apply STROBE guidelines when preparing manuscripts that include mixed designs, such as observational data embedded within interventional study?
Okay. So basically, if we are doing qualitative and quantitative analysis both, so same 22 points are we have to check from the list, and sometimes it some part is like you can say qualitative part, and sometime part is quantitative parts. So in both part, like if it is a mixed method, so we have to check 22 all the 22 parameters. Anything?
So the next query that we have is from Kirti Nagda. In mixed method study, how we choose the standard number of sample size of population?
Sample size actually is a separate topic, but sample size, as I already discussed, like sample size uh, have to be calculated by using different uh, sample size calculators available on net. Sometimes you directly calculate uh, without the taking help from any person directly, or there are standard formulas in which you must know how much confidence interval you are taking, how much total, what is the total population, what is the prevalence of the study, and this whatever prevalence you will take, it will affect your sample size. How much error you allow, it will basically uh, affect your sample size. So whether it is a qualitative, whether it is a quantitative study, sample size calculator are available on net. So by using that, you can calculate sample size, or you can, because sample size calculation is the most typical part of your research, and sometimes many researcher mention like convenient sampling. They take only 200, 300 directly. So it is not authentic actually. So in our research, or if you want to publish your research in good journals, so you have to calculate your sample size appropriately by taking. If you are not able to understand much statistics, you have to consult some statisticians, then only calculate it. Okay.
So we have a question from Shivani. What's a practical non-statistical strategy for researchers to proactively minimize confounding during during the study design phase rather than just addressing it later in the analysis?
For confounding, we use the matching. For controlling confounding, we use matching, like we take equal numbers in while comparing. So it reduce much confoundings.
So another query is from Gauri.
Hmm.
Are there any specific precautions Ayurvedic researchers should follow when applying the STROBE guidelines?
No, these guidelines are similar for all researcher. Uh, like whether he is a like from allopathy or from Ayurveda or from homeopathy, these guidelines are same, because epidemiological studies are like in which epidemiological studies are same for both or all the disciplines. So there is no difference. These STROBE guidelines are similar for all the researcher.
I think we don't have any more queries, sir.
Hmm.
Thank you so much, sir, for giving your valuable time and your deep insights on the topic. We're extremely obliged with your concern and your efforts and your time that you are giving to us and our students.
Thank
We
you,
have
Rakesh.
posted the feedback form in the chat, so everyone can access the feedback form there.
Okay. Thank you all. Thank you, Principal Sir. And